Hello, good afternoon. My name is Dr. Judy Ufondo of Snowspirations Global Health Solutions. It's weekend, and I hope you're having a wonderful weekend. I hope you had some time to check on yourself and check on your family. Today, we're talking about the fertile SGHS woman. What makes you fertile? So, what makes you qualified to be a mother, which is pretty much what fertility is all about. So, what are those fundamentals? What are those baseline things you have to acquire so you can become a mother exactly the way God designed you? So, that's going to be the topic this evening. So, once you come in, let me know who you are, let me know where you're located. And as soon as we have a good number, we're going to start. I'm planning to spend about 20 minutes. So, I will use the first 10 minutes for my presentation. Then the second 10 minutes will be an opportunity for you to ask your questions. So we're talking about the fertile SGHS woman. What are those things you need to imbibe? What are those steps you need to take so you can actualize your God-given fertility? Every woman is a mother from the point you happen to be on this world. God made you a mother by preferring you a woman. So now it's your duty to conform your lifestyle, to conform your actions on daily basis so you can mirror what God wants you to become. So that's going to be the basis for my discussion this afternoon. But I want everyone that wants to participate to join. When you join, please introduce yourself properly. And once we have a good number, I'm going to start. Admin is going to join. Admin is going to help you. Remember, tomorrow is a big day in our organization. We have a big summit, the SGHS Fertility Summit, couple-related summit. So if you're coming, make sure your male partner is going to be in attendance. If you're a man, you registered, make sure your female partner is going to be in attendance. We want to talk to you guys from a perspective of a man and a woman. So make sure you register before today ends. Today is the deadline, and you don't want to miss this because it's something that will help you a lot. Now, let's talk about the fertile SGHS woman. You see, during this particular presentation, you're going to know the impact of lifestyle, your love life, and your fertility. So your lifestyle, what you do every day, can actually help or harm your fertility. Your love, your love pattern, how you love, who you love, how you engage, can also help or harm your fertility. So you're going to learn the essence of your yearly well woman check. Every woman is encouraged to embark on their yearly well woman check. When you go for this yearly well woman check, we're going to take time to know how you're faring, areas you're having challenges, areas we need to attend to you more. So every woman in our community, for you to become a fertile SGHS woman, so for you to become an SGHS woman that will become pregnant and have a baby, you must cultivate the habit of going for your yearly well woman check. Yearly well woman check simply means you're going to bring out one day in the 365 days in the year. Then you're going to book an appointment with your gynecologist. You're not necessarily supposed to have any problem, any symptoms. You're just going to bring out that one day. You go to your gynecologist. Then we take time to examine everything about you and make sure you're doing good. So you're going to do this to make sure your fertility is still intact, to make sure if we discover anything, we're going to fix it. Now, to become an SGHS fertile woman, you also need to know the roles of the healthcare providers that will provide you services, that will provide you education, that will provide you counseling and services throughout your lifetime. So the lifetime of a woman is something you need to be conversant for all through your life. It doesn't end. Until you go to heaven, you're going to learn how to survive every day as a fertile SGHS woman. Now, what are the condiments? What are the specific areas you need to focus more on if you want to completely be fertile, if you want to completely actualize your fertility potentials? Definitely, we're going to talk about screening. There are basic gynecological related screening that every SGHS woman must be conversant with. Your breast and cervical screening. Every woman in our community should be conversant with breast self-examination. This is just the baseline. So when you're taking your bath or once in a while, you take a good look at your breast, you examine them to make sure you don't have lumps. Sometimes you might have an ongoing cancer in your body, and if you don't know the signs and the symptoms, it might actually come to the stage where it will be advanced and it can kill. So we also need to keep an eye on the cervix. So you need to go for your pap smear. We need to also make sure you go for your sexually transmitted infection screening. So we keep an eye on you. Now, you also need to think about pregnancy prevention. Every pregnancy must be fully planned. So a fertile SGHS woman is not a woman that will just be making love without planning. You have to plan your pregnancy. If you don't want to have a baby, then you have to think about pregnancy prevention. Pregnancy prevention is also part of making sure you become a fertile woman, because you have to have babies you can take care of. You have to make provisions for how pregnancy will change your life. So a fertile SGHS woman will also think about pregnancy prevention. You also have to think about your prenatal services, your pregnancy services, your childbirth services, and your postnatal services. They are all related. So it's all about planning. It's all about going for help when you need one. A fertile SGHS woman should also be very conversant with infertility evaluation. So you should be conversant with what you need to do for a particular time frame if you're looking for a baby and it's not forthcoming. You should be conversant with age 35. You should be conversant with your baseline fertility testing. You should be conversant with what your partner needs to do and what you need to do. So these are all the things you need to be very conversant with. For example, you should be conversant with fertility evaluation, which will involve checking your hormones, checking your tubes, checking your ovaries, checking your womb, checking your body weight, checking your stress pattern, checking your sleep, checking your lifestyle. These are all gonna be things that will help you to either become or not to become. So very important you take all this stepwise process of becoming a fertile SGHS woman. Now, a fertile SGHS woman should also be conversant with the role of age. You see, you're not going to be fertile for the rest of your life. Your fertility will keep dwindling for every birthday you celebrate. So by the time you get to your 35th birthday, you need to be careful, because at the 36th birthday, your fertility is declining. By the time you get to 37, it has drastically declined. By the time you're getting to 40, you only have fewer remaining eggs. So you should be conversant with expectations, with how to deal with them. Like if you're tending towards 40, you begin to notice some changes in your body, dry vagina, low libido, mood swings, night sweats. They are all evolution of your menopause. So if you're conversant with them, you can modify your lifestyle to meet expectation. There are certain things that are not medical problems. Becoming pregnant is not a medical problem. Going through your menstruation is not a medical problem. Going into menopause is not a medical problem. They are all expected medical milestones. Every woman at some point is going to bleed. Every woman that want to become pregnant at some point is going to become pregnant, and every woman will go through menopause. So these are not medical problems. These are expectations you need to know how to manage. Now, a fertile SGHS woman should also have a clear-cut medical history, a clear-cut surgical history, a clear-cut gynecological history. Your histories are very important in shaping your ability to become. There are some surgical histories that might affect your ability to become pregnant. There are some gynecological histories that might affect your ability to become pregnant. There are some obstetric histories that might affect your ability to become pregnant. For example, if you have conducted any surgical procedure in the womb, it's important that particular procedure was done appropriately and your womb is fully recovered, because anything that affects the integrity of your womb will likely lead to your inability to become pregnant. So everything I'm mentioning are the steps you need to take to be a fertile SGHS woman. So in summary, a fertile SGHS woman is a woman that knows everything about pregnancy screening, prenatal health, perimenopausal health, infertility workup, surgical history, gynecological history, social and family history, because everything, it's all about how you manage yourself. Everything is how you modify your lifestyle, making sure you don't drink alcohol, drinking a lot of water, exercising, sleeping properly, having good relationship, being very communicative, getting services, seeking the help of a fertility specialist, seeking the help of a gynecologist, making sure you're not abusing any drugs. Everything is all connected. Now, a fertile SGHS woman should also be conversant with the basic immunization she's supposed to have. There are certain immunizations you're supposed to take so that it will prevent you from developing problems in the future. For example, human papillomavirus is a no sexually transmitted infection which can actually predispose you to developing cervical cancer. Now, thankfully, we have vaccines against them. Hepatitis B Very deadly. Thankfully, we have vaccines. Currently, we are trying to do some experiment on malaria vaccines. So there are so many vaccines, tetanus vaccines. So there are so many vaccines and immunizations you're supposed to have. So it will help you to actualize your potentials. Now, you should also be conversant with your preventive health, your basic numbers, your blood pressure, your blood sugar, your body weight. A fertile SGHS woman should know about all this. And by extension, also follow the partner to make sure the partner is also doing the right thing. So you will learn how to work together with your partner, with your healthcare provider, to make sure you exercise, to make sure you lose the body weight you don't need, to make sure you practice safe sex. And eventually, when you become pregnant, have a healthy pregnancy. So a fertile SGHS woman is a woke woman, is a wise woman, is an enlightened woman, is a smart woman, is a woman that knows exactly what she needs to do so she can start having her kids, so she can start having her boys, her girls, her twins, her triplets, her quadruplets. A fertile SGHS woman is a woman that will overcome all odds and still succeed in becoming a mother. That's my presentation. I'm going to quickly give you an opportunity to start asking your questions. So please go ahead and start asking your questions. Immediately after this presentation, I'm going to repeat the same in Facebook. So if you're in our Facebook page, in our Facebook group, please join us immediately and I will repeat this same topic. But right now, the clinic is going to open and it's an opportunity for you to start asking your questions. I can see moderator Chinyere in the clinic. Chinyere, please feel free to ask your questions. Then I think I have other two people in the background. If you have any questions, feel free to ask your questions. We have about 8 minutes to take care of your questions. Then we close the clinic and head to Facebook. So please feel free to ask your questions on a fertile SGHS woman for this weekend clinic. So go ahead and start asking your questions. If you have any, even if it's not related to this topic, feel free and ask all your questions. Okay, at what age should young girls start well woman check? Now, this is a very, very important and a very technical question. So once your girl starts bleeding, she can become pregnant. Now, most girls will start bleeding when they are still within the pediatric age. So pediatric age will end around the age of 18. Now, we wouldn't want an 11-year-old or a 10-year-old or a 9-year-old that started bleeding to start going for well woman check. We wouldn't want to do that. But as a mother, you're supposed to still take that particular child to the pediatric visit, especially the wellness visit. So it's age specific and it's age related. So in as much as your daughter might have started bleeding at the age of 9, you still have to schedule an appointment to meet with the pediatrician because that's still a pediatric age. In as much as some kids in pediatric age can become pregnant. But that's where the limitation will be. Now, by the time they graduate to teenagers, by the time they go off the pediatric age, then from age of 18, it's expected they go for their yearly well woman check. However, majority of women that actually take yearly well woman check, more serious are women that are believing to have kids. But yearly well woman check is not necessarily for just having kids. It's to have an overview of you as a woman. Okay? So personally, if your daughter is not up to 18, still make sure you go for all the routine checks with the pediatrician, seeing your daughter. If your daughter is beyond 18, then your daughter needs to retain the services of a gynecologist. And because at that 18 is when they will start experimenting with sex, and we need to make sure we inculcate good habits and good lifestyle in them. I love that question for so many reasons. A woman that has entered menopause, is she expected to still continue? Of course. Your well woman check is not just all about having babies. Your well woman check is to make sure the totality of you is taken care of. Body, mind, spirit. So a woman that is perimenopausal or menopausal will have some symptoms. We'll still have certain things we are still going to keep an eye on. We're still going to keep an eye on her blood pressure. We're still going to keep an eye on her body weight. We're still going to keep an eye on her sexual history, on her sleep pattern, on her stress level, on her mental health. So there are so many things every woman should benefit from. Whether you want to have a baby, whether you're premenopausal, whether you're menopausal, it doesn't matter. Every woman needs to go for yearly well woman check. It's during yearly well woman check that we can discover certain things that might not give us sign, and certain things that if we don't discover on time, that woman will be a problem. Now, unfortunately, majority of the medical problems that women will develop, they will develop them as they are getting older. For example, cancer. Cancer development is commoner as you're getting older. So if you don't form the habit of going for your yearly well woman check, if you form the habit of only going to the hospital or seeing your doctor only when you're sick, that's not good. It's not only when you have a headache, you have fever, you have pain that you see your doctor. You see your doctor when you're feeling better, when you don't have symptoms. That's called yearly well woman check or preventive visit. You don't just wait for a fever or pain or whatever to develop before you now start going for treatment based on the symptoms you're having. You're supposed to bring out one day, and your provider will take time to check everything about you. There are some women that might have some medical problems and they won't have any symptoms, and those medical problems can actually be damaging certain things in your body, because there are some medical problems that won't give you symptoms, but they are damaging stuff in your body. And if we don't discover them, by the time we discover them, it might be late, including cancer. There are some cancers that will not give you any signs. Unfortunately, by the time we are discovering this cancer, is already metastasized, and once cancer metastasized, the chances of you making it is very, very slim. I'm loving all this question. Does discovering lump in the breast automatically mean breast cancer? No, my sister. Thankfully, majority of the lumps discovered in the breast are benign. So benign means they are not cancer. However, some might be cancerous. Your duty is to make sure you examine appropriately, then you report back to your doctor. But thankfully, majority of the lumps that women will notice in their breast might be coming from what we call fibroadenoma. We just go in there, we take care of that, and you're good. But anytime we remove any sample from your body, we must send it for pathology. We must make sure that it's not cancerous. Anything we remove from your body must be sent to histology to make sure it's not a cancer-developing cell. I love all these questions. Chinyere, it looks like you're going to go back to medical school because your questions are very, very good and technical. What are the likely causes of cervical cancer? Now, the chief implicated organism in cervical cancer is human papillomavirus, HPV. There's a particular strain, it's not all of them. 16 and 18 strain can predispose you to having cervical cancer. Now, thankfully, it's preventable. There are two major gynecological cancers that can actually be prevented 100%, your breast cancer and your cervical cancer. How can we prevent cervical cancer? Of course, we know it's attached to sexual partners, right? So if you get exposed to human papillomavirus, which you can pick from sexual contacts, then we can prevent that. How can we prevent that? By preaching, protective and smart sexual relationships. So you use your condoms, you make sure you don't have multiple sexual partners. But thankfully, we also have a vaccine. So if you take the vaccines against HPV, you might not likely come down with HPV. And if you don't likely come down with HPV, possibility of developing cervical cancer is limited. However, there are some other factors that can also predispose you to developing cervical cancer. But we know there's a relationship between human papillomavirus and development of cervical cancer. What do you need to do? Make sure you go for your pap smear test. Pap smear test is a test that will enable us to take a look at the cervix and see if there are changes in your cervix. Deborah Mensah, thank you, Doc. What will cause blood not to flow through the womb? Well, let me just explain it, my sister. If you don't have blood flowing through your womb, then your womb is dead. Any part of the body that doesn't receive blood supply is not going to live. So it's not true. There is no condition that would make blood not to flow to your womb. If blood is not flowing to any area in your body, that area is completely dead. Now, if you have anemia, I understand that. Anemia means you have a reduction in hemoglobin, which is the oxygen carrying capacity in your body. If you have that, I can understand. And there are some couple of gynecological problems that will lead you to abnormal bleeding. Like if you have humongous fibroids and you're bleeding excessively more than you should, the more you bleed as a woman, the lower your hemoglobin level, and the lower your hemoglobin level, the possibility you're going to develop anemia. So women that are heavy bleeders will likely have hemoglobin level that will be lower than women that are not bleeding much. So the duty is to know the gynecological problems that might be leading to that bleeding you might be having. But there is no such thing like not having blood in your womb. Any part of your body that doesn't receive blood is going to die immediately. Every singular part of your body receives blood supply. Once blood stops going to any part of your body, that particular part of your body is going to be dead, because your blood contains oxygen. Oxygen is the basic reasons that is actually making you to live. So any part of the body that is deprived of the oxygen to live, that particular part of the body is going to die. So for example, if you don't have adequate blood pumping and getting supply in your heart, you're going to have heart failure. If you have lack of blood in your brain, you're going to have stroke. You're likely going to die. Any part of your body that doesn't receive blood and oxygen, that part of your body is going to have problems. Okay? Herpes simplex is a virus infection you can pick. Now, when your immune system is down, that's when you have an increased possibility of picking herpes simplex virus. Okay? All right. Do we have any other question? It's actually 20 minutes, so I'm going to be transitioning to Facebook. So thank you for coming. Join me in Facebook. If you intend to end your infertility, if you're tired of being an infertile woman, which God actually bloated away from you. When God made you a woman, God made you a fertile woman. But if for some reasons you're going through challenges in the world and you have not been able to become pregnant by yourself, please show up tomorrow. We can help you. Go and register for that event and we'll meet you halfway. So please, Chinyere, join me in Facebook. Deborah, correct? Deborah Mensah, you sound more like a Ghanaian. Join me in Facebook and we continue the conversation. Thank you for coming. Thank you for all those very important clinical questions. If today is the first day attending my clinic in YouTube, thank you so much. Before you leave today, make sure you subscribe to this channel, share the channel with all the people that will benefit from them. And until I see you guys on Tuesday, my next clinic will be on Tuesday. God bless you and take care of you. Bye-bye for now.